Welcome to the Virtual Training Institute. And you may notice that you were muted upon entry. I'd like to identify the questions section on the control panel. That's where you can use to chat with Ramona to ask her questions. And so as we get started today, I'd like to launch a poll of what you are doing within your program. So what is your role within your program? Go ahead and choose the most appropriate answer. All right, excellent. Let's take a look at who we have available to us today. Fairly evenly split between ABE instructors and other. We also have some ESL instructors and some instructional specialists. So welcome everyone. And with that, I am going to turn it over to Ramona Kunkel for her session on managing stress and anxiety in the classroom for you and your learners.
Thank you, Ellen. So I want to welcome you all to the session on managing stress and anxiety in the classroom for your learners and yourself. My name is Ramona Kunkel, and I'm the Adult Education Program Specialist with the Maryland Department of Labor. So today we're going to cover briefly some other possible disorders, the difference between anxiety and stress, the symptoms of stress and of anxiety, some teaching strategies and tips for helping you help your learners manage their stress and anxiety, and some strategies and tips for instructors to manage their stress and anxiety. So the reason I wanted to also list some other possible disorders is that it's very common for our learners to have multiple disorders. So this is on this slide and the next slide, there are some possible disorders that your learners may have, but may or may not have been diagnosed with. I just want to put out a little bit of a word of warning that you want to be careful when talking to or about a learner in assigning a diagnosis. Unfortunately, this seems to happen all too often when some think that having difficulty focusing or concentrating automatically means that that person has ADHD or ADD. So no one should be self-diagnosing, and especially as educators, we should not be making claims about ourselves or others without an assessment or testing that has been done by a certified professional who is qualified to make those determinations. So this is not a list of every disorder. This is a list of the most common disorders that you may see. So we see that some of these broader categories, such as anxiety disorders, have subcategories such as general anxiety disorder, panic disorder, phobias, and social anxiety disorder. Keep in mind that there are certain criteria that need to be met for something to be diagnosed with a disorder. So, for example, if somebody is diagnosed with depression, it has to be have lasted for, I believe it's 2 years, and then even within that, you need to have a certain number of episodes within a shorter period of time for that truly to be considered a disorder. So here are a couple more, and I just want to draw this to your attention because I thought this was interesting, that opioid use disorder is actually listed. I was kind of surprised by that. So according to Johns Hopkins, it's an estimated 26% of Americans ages 18 years and older, that's about 1 in 4 adults, suffer from a diagnosable mental disorder in a given year. So many people suffer from more than one mental disorder at a given time. So in particular, depressive illnesses tend to co-occur with substance abuse and anxiety disorders. So we're going to look at anxiety and stress as well as the difference between the two. I want to mention this because I thought this was interesting. There is a difference between anxiety and stress. But in several of the articles that I found when I was putting together this presentation, I found that there were cases in which those two terms were used interchangeably. So take that for what it's worth. So we're going to take a look at anxiety and stress, how they are different, and how they fit together. So what is anxiety? So the American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. So those with this disorder usually have reoccurring intrusive thoughts or concerns. Sometimes those thoughts can be triggered by something someone says or does, and other times those intrusive thoughts can seem to come out of nowhere. So some have described it as a feeling of dread or impending doom. It's a feeling as if something really bad is going to happen, but you don't know what it is, and or it may not be grounded in reason or logic. So sometimes when somebody has anxiety, they try and figure out, well, why am I feeling this way? Like, what happened that caused this to bring this on? And they just can't pin it to anything. It's almost like it just happens out of the blue for no rhyme or reason. So now we're going to look at what stress is. So this is a normal reaction to everyday pressures. However, if you have too much of it or it feels like too much, that can interfere, that can also interfere with your everyday activities. So for those who have heard my presentation on toxic stress, know that this can have a profound effect on children who grow up in unstable, abusive, and dangerous home environments. There are many factors that can lead to toxic stress that can have a lifelong effect on the child into their into their adulthood. Those children of toxic stress then become our learners. While their current situation may not seem overly stressful, the toxic stress from their earlier years may affect their executive functioning and self-regulation. This can make it difficult for them to manage their time, make decisions, pay attention, remember details, and regulate their self-control. So this diagram shows the effect that stress has on our body, mind, emotions, and behavior. So some behaviors that present themselves that may look like laziness, inattentiveness, or lack of interest may actually in fact be due to stress. The good news is more research and information about neuroplasticity and the brain's ability to make new pathways is getting out. I actually have been recently listening to some webinars about PTSD, and it's amazing some of the science and research and different techniques that are being used right now in therapy, and the ability for our brain to be rewired. It takes a lot of effort, it takes time, but the good news is that we're not stuck in these states, you could say, that there is research showing that we can change this and we can make our lives better. I do want to point out one thing, is that on these slides, I do put the links to my resources for where I got this information in case you are looking for more in-depth information about what is on these slides. So now we're going to look at what is the difference between, how stress and anxiety, how they're different, but also how they fit together. So stress is a response to a threat in a situation, and then anxiety is a reaction to that stress. So stress is just a normal response that our bodies have to any change. So that includes even good change. So, we sometimes think of stress only in terms of negative experiences, but even something like having a baby. You may be really excited to have a baby, but as many new mothers and fathers find out, it can also come with a lot of stress with that. So stress is just a response to change. So anxiety can also be the result of prolonged stress, along with depression and panic attacks. So stress and anxiety do share some common characteristics. And again, I think that may be why in some articles they use those interchangeably. So I like this little diagram because I thought it was sort of a nice little sort of summary of the difference between stress and anxiety. So we see that real simple. Stress is a response to a threat in a situation. Anxiety is just a reaction to that stress. Stress is a temporary experience. I think this is where the big difference comes in. Anxiety is a sustained mental health issue. So again, anxiety is stress that has been prolonged, that has been reoccurring, has occurred for a significant period of time. And then anxiety is considered severe when it is very prolonged and happens in the absence of a stressful event, or it is interfering with daily activities. So anxiety disorders are actually the most common mental illness in the United States. I want to mention something here that I attended a learning disabilities conference in February, and I attended a workshop that was given by the University of Nevada in Reno about specifically anxiety. And they did a survey at their university, and they tracked it for 10 years. And they found that the number of students that were experiencing anxiety just skyrocketed in the last 10 years. This may not come as a surprise to most people, but the belief is, not just with them, but with others in other workshops that I attended, that social media is a big contributing factor to that. We know that people are great at, I'll say, bullying on Facebook when they can hide behind a computer. And so unfortunately, that has really ramped up the amount of anxiety that just the general population is experiencing. Okay, so we're going to briefly talk about some of the symptoms, and we're going to focus on generalized anxiety disorder, just because it's sort of like the most common. So here are the symptoms that someone with generalized anxiety disorder may have. So again, for this to be a diagnosis, the anxiety needs to last for a significant period of time. So occasional events of anxiety generally does not mean that someone has generalized anxiety disorder. So there's a feeling of restlessness or just kind of feeling on edge. Again, you may not always know where it's even coming from. Uncontrollable feelings of worry. Again, you may not even know why, and you may not even be able to pinpoint what that worry is. Increased irritability, concentration difficulties. So again, what may look like a student is just lazy or isn't paying attention may actually be the result of anxiety. And as you might think, sleep difficulties. So, there's a lot of rumination that goes on with anxiety, a lot of, just replaying something over and over in their head. So they have difficulty falling asleep, or they may be able to fall asleep, but then wake up in the middle of the night and then start with their rumination and have difficulty getting back to sleep. So people with generalized anxiety disorder will experience them at persistent or extreme levels. And it may present as vague and unsettling worry or a more severe anxiety that disrupts day-to-day living. So here are some of the, oops, I think I went too far, yeah. Some of the physical symptoms of stress. So again, fatigue. What may appear to be just tiredness or, the student not wanting to pay attention. It may actually be because of stress. Headaches, stomach, muscle tension, change in diet, teeth grinding, and feeling dizzy. And some of the psychological symptoms of stress are experiencing irritability or anger. So if the student sort of loses their cool almost out of nowhere, it actually may be a result of something called chandeliering. And chandeliering is, from what I can tell, a relatively recent term. It's when somebody holds in their stress or their anxiety for a long period of time because they're trying to manage that, and it builds up and builds up and builds up, and then there'll be one little relatively minor incident or experience, and the student just flies off the handle, and everybody's left wondering, oh my gosh, what the heck happened? Well, it's not that one event. It's the result of this accumulated anxiety and frustration and stress that just finally just lets loose in this one moment. They may feel nervous, lack of energy, feeling as though they could cry, and again, lying awake at night due to stress. So again, we see some overlap with anxiety and with stress. There are some common symptoms and some common things going on, which again is where it can look similar. So we're going to look at some teaching strategies that you can use to help your learners with anxiety or during a stressful event. So obviously you can't control everything that goes on in your classroom, but there are some things that you can do to minimize the level of stress a learner or even your learners feel in the class. So these are some that I gathered, again, from this Learning Disabilities Conference that I attended in February. So much of the conference actually, even though it was called Learning Disabilities, focused on anxiety and ADHD. So one of the strategies was the use of graphic organizers. So some students become very stressed and overwhelmed when they can't make sense of the information in front of them. It's like it's just too much. There's too many words, there's too many concepts, there's too many ideas going on at one time. So graphic organizers can help them separate out pieces of a passage. So you may just want to take a paragraph or a relatively short passage and have them, put the main idea in the middle and then the details around just in a summary form to help them simplify it so it's not so overwhelming and there's not so much information at one time. Another suggestion was to reduce distractions as much as possible. Now, sometimes, you can control that, and other times it's a little bit more challenging. But for example, one example is, while small group work may be fine for some learners, it can be very distracting and stressful for others. That doesn't mean you shouldn't do it, but it's just, you want to be aware that some students can become very overwhelmed. It's what they call sensory clutter. So, you have this group over here talking, this group over here talking, and yet they're also supposed to be paying attention to what they're supposed to be working on in their own little group. So again, just be mindful of that. Also, to try and slow down. I know that I can have a tendency to talk fast sometimes. In fact, right now, I'm really being very mindful of slowing down my speech, because I can talk very quickly especially when I get nervous or when I'm doing a presentation. So, try and slow down maybe your speech a little bit, because if you're talking too fast, again, that's going to create a lot of stress for them. It's too much information coming at them at one time. Another strategy is to provide different ways in which a learner can express themselves. So with that said, they shouldn't be allowed to express themselves in only the way in which they are comfortable. We all need to perform tasks and in a way that can be outside our comfort zone. So I'm going to piggyback on this a little bit with talking about learning styles. For quite a while, there was a lot of talk about, learning about your students' learning styles and then gearing your instruction towards that students' learning styles. I went to a workshop, again, at this Learning Disabilities Conference, and one of the things that they said, and I've since read the same thing, is that there is absolutely no evidence that supports using their preferred learning style helps them improve in their literacy or their math skills. The whole idea is that while a certain style may help them, yes, no evidence. That's exactly what they said. They said no evidence. And those were their words. The idea is that while you may want to have them work primarily in a style, you still want to have them utilize other styles, because all those other styles are still working and are still getting into their thought process, so they can all work together. You want to encourage metacognition and correction. So I want to give you some examples of what I've done. So a learner correcting their own mistakes makes a bigger impact and impression than if the instructor does it for them. So here are two examples that I can give you what I use when I taught. So I had a rule in my class that when learners read out loud, no one was allowed to correct the learner except for me as the instructor. And there was a number of reasons why I did that. One, I didn't want to have 5 learners jumping on that one student, correcting them. And quite frankly, sometimes they were correcting them incorrectly. So one student saying one thing, another student saying something else, and 3 other students are saying another thing. The other reason was I didn't want to create a hierarchy of learners who were better readers and other readers who were struggling. And the reason I did that was because when a learner made a mistake, I held back for a few seconds and I let the learner get to the end of their sentence. And I wanted to see if they could self-correct, if they could think for themselves, oh my gosh, that doesn't make sense. That sounds wrong. And then I let them go back and read the sentence again and see if they could correct themselves. And more times than not, they could actually fix it themselves. Now, if they really got stuck, then I would step in and help them out. Likewise, and this is just what I did. I'm sure there may be some that will disagree with me, but when I graded math papers, I only put a C next to the problems that they got correct, and I put nothing next to the ones that they got wrong. The reason I did that was because I wanted students to focus in on the ones that they got correct. If I put X's, all they're going to look at is the X's, and they're just going to say, oh my gosh, look how many X's there are. And then what I would do is I'd say, you might want to go back and look at the ones that don't have anything next to them, but look how many you got right. So I can see that you know what you're doing, because look at all the ones that you did well. And I wanted them, and I would even say, I want to see if you can find your own mistakes. And again, more times than not, they were able to go back and find their own mistakes. And when they found their own mistakes, and again, made a greater impression on them than if I just went ahead and found them and pointed them out for them. This next one is kind of an interesting one. Practice a 3-minute meditation session at the beginning of the class. So one of the presenters that was giving this presentation, and it was about executive function in math, I believe he taught in the middle school, and what he did is he would ask his students if any of them felt stressed. And usually no one would raise their hand, and he'd say, well, you know what? I'm actually feeling a little stressed myself. So, you know what? I really think it would help me if I just did like a 3-minute meditation. So I just want you to all kind of like work with me and join me. And I think it might help us all out. So he would do a 3-minute meditation. That's all it took, just 3 minutes. And then he would get done and he'd say, gosh, you know what? I actually feel better. And he would ask the students, does anybody else feel better? And again, most of the students would then say, yes, that they felt a whole lot better. So it may not be something you're real comfortable with trying, but you can always try it and see what happens. I just thought that was kind of an interesting strategy to use. So here are some more teaching strategies. So if your voice isn't calm, your learners are going to pick up on that, and they will likely raise their level of stress. So when you stay calm, it will likely reduce their level of stress. Something that came up over and over in this conference was having empathy. So having empathy means that it requires you to step outside of your own emotions and to review things entirely from the perspective of the other person. So that can sometimes be difficult, especially when, we may be getting triggered ourselves, but that was a pretty common theme throughout the entire conference. One of the things they also stressed was avoid saying it's not a big deal. So they even said, like, this is one of the most damaging things that you can say to a learner. So while the trigger situation may not be a big deal to you, but depending on the circumstances and why it triggered that learner, it may be a very big deal to them. So you certainly don't want to make a bigger deal about it than what it is, than what's necessary, but at the same time, we don't want to dismiss what the learner is feeling. So, what can happen is that even you or another learner could say something as a joke, and it may be a trigger for that learner. So without knowing everything about that learner, we don't know what might have set off their stressors. Next one is about being predictable and procedures. So learners need predictability. There's nothing more distressing than going in and them having no idea what's going on. It would be sort of similar to us going into our workplace and they say, nope, sorry, that's not your desk today. You're going to be sitting over here. Oh, and you're going to have a totally different job today. That would really stress us out. Maybe that's a little bit of an exaggeration, but you want to have some sort of predictable routine. So when I taught, and you may not want to go to this level, but I taught, so I'll use this as an example. When I taught a class that was about a second or third grade reading level, it was the same pattern every day. For about the first half hour, we did phonics and sight words, 45 minutes of reading, 15-minute break, and then an hour of math. Every single Thursday, they knew we were going to do sight word bingo. It's just what we did. And they knew that that's what was coming. So that gave them sort of a level of comfort in knowing, okay, I'm not just going to have something thrown at me. You also want to give sort of warnings before transitions. So you can say something like, okay, we're going to put away our reading books and we are going to get out our math books. Just something so that they know what you're doing. So you may know in your head, okay, we're done with reading and we're going to move on to math, but they may not know that. So you want to give them some heads up about that so that they can mentally make that shift. Again, for us, it may not seem like a big deal, but for them, especially when they've lived in, a world of unpredictability and chaos, just knowing what's coming can make a big difference. Preferential seating. So if your classroom happens to be set up in rows, some learners may do better by sitting up front where they may be less distracted by what's going on around them. So if they're sitting in the back, they can see what's going on with this student over here or what's going on over here. And that may be very, very distracting for them, and they may have a much harder time focusing. So we have some more teaching strategies. So offer options for regrouping. So some learners may do better with one or two other learners based on personality or skill level. So it may not make sense to put together two learners who are easily distracted. They may have a hard time staying on task, where you may need to sort of pair them up with somebody who is much more focused and can sort of help that other student stay on task. Breaking complex tasks into smaller chunks. So some learners can become very overwhelmed with a big project. So if they're working on a big project, you may actually want to lay it out in some sort of a chart or a timeline so that they're making it into much smaller tasks that are much more manageable. If they just think about this big project, it's, again, too much coming at them at one time. They need to see these smaller little segments that will make a lot more sense for them. Respect and acknowledge feelings, but put them in perspective. This one's a little bit of a tough one. So you want to respect and acknowledge their feelings, but you don't want to coddle them. You don't want to sort of make it into a big deal, like, oh, I'm so sorry, I'm so sorry. I know this is really overwhelming. I know this is stressful. When you do that, it actually feeds into their anxiety and just ramps up their anxiety even more. So you want to do, but at the same time, you don't want to be dismissive. So, something more like, yeah, I know it's a little overwhelming right now. So, let's think about something that we might do. Or, do you want to take a break? Do you want to go get a drink of water? Do you need some time, to regroup? Just offering something that might allow them just a little bit of break. So you don't want to try to avoid the stressors, but teach them to manage them. So you don't want to say, oh my gosh, well, I know that this is going to be a stressor for this learner, so I can't do that. That's not really helping them, because let's face it, they will probably somewhere in their life have to deal with that stressor. If you constantly set up a scenario where they never have to deal with that, they never learn how to manage it. They never learn how to address it and to figure out ways to get through those situations. So again, you don't want to throw them into an intentionally overly stressful situation, but you don't want to set it up so that you're constantly managing everybody's stress, or that probably is going to create a lot of stress for you. Okay, so we still have more teaching strategies. So sometimes you just need to listen to your learners and give them an opportunity to talk in class. And yes, this sometimes takes time away from instruction, but depending upon the situation, it can be the best time spent. So I have had situations in my class where there have been, and we'll even use this as what we're going through right now. We're going through a lot of very stressful situations in our world, in our country, that could definitely be triggers for our students. And sometimes it's therapeutic for them to just have a platform to talk, because in some cases, they don't have anybody who's going to listen to them. Now, you don't want them to go on and on for, forever, but, it sometimes can be very helpful for them to just sort of get it out, because otherwise, if they're just thinking about that situation, they're just thinking, that's what they're thinking about. They're not thinking about what's going on in the instruction. They're just constantly replaying what it is that they're thinking about. So it can be actually it can be helpful. It can help students express themselves. And in some cases, your classroom is going to be the only safe space for them to do that. And, we want to provide a safe space for our students. You want to also give learners an opportunity to talk privately. So, if they don't want to share, maybe you need to talk to them privately, one-on-one, and let them express themselves. You also want to give learners strategies for managing their anxiety and stress. So I'll give one example. When I worked in a program, there was a learner who, let's just say, expressed her frustration and her anxiety in not the most productive way and wound up being asked to leave for the day. She was allowed to come back, but she had to meet with me first. And so I told her I wanted to talk to her. Right away, she was afraid she was in trouble, and I said she wasn't in trouble. And I just said, I understand that you were having a really tough time yesterday. Is there anything you want to talk about? And she just unleashed a laundry list of all these stressful things that were happening in her life. And so we sat and we talked about some things that she might want to do in the future moving forward. Things like getting up and walking outside, getting a drink of water, just things that she could do that could possibly make that not such a stressful situation in the moment, instead of sort of unleashing and, bursting out in the middle of class, that would then allow her to return back to the class. And also let learners be creative. You know, we sometimes think that, well, because they're adults, we can't have fun and we can't be creative. But sometimes those creative outlets really help our learners reduce their stress. So just think about us. You know, they have adult coloring books now, right, to help us reduce our stress. So I had a class in which I was doing geography, and they had to color in, you know, different parts of the world, you know, this color for Asia, this color for South America, this color for Africa. And I had this really, you know, big, strong guy in my classroom. At the end of the class, he said, Miss Ramona, can I have a blank map? Because I really want to take this home and I want to do this again and I want to make it look a whole lot nicer. And that just really made an impression, because it was an outlet for him. It was just a way for him to do something that was sort of like fun, that probably also reduced the stress, but he was also learning at the same time. Okay, so, all right, so I included this as a resource for you. This is a somewhat lengthy publication called Reducing Stress and Promoting Mental Health in the ABE ESL Classroom. It's put out by World Education, and here's the link. So I just put it there because it might be something that you would be interested in looking through. Okay, I need to get humming here. So now we are up to managing your stress. So, you know, there's two parts of this equation. It's not just about managing your learner stress, it's also about managing your stress. So while we all have triggers and we all have learners that can get under skin, especially depending upon what we have going on in our life, the reality is your class has a better chance of remaining calm when you remain calm. So some learners have very chaotic lives, and you may be the only person in their life that is a source of stability. You may be their only positive role model, and therefore you want to do whatever you can to be a good role model. So this is sort of a combination of different sources that I pulled together. So one of them is staying non-judgmental, and that's about yourself. So if a lesson doesn't go well, or an interaction with a learner could have had a better outcome, you know, one of the things you can do for yourself is don't beat yourself up. Just take a step back and say, okay, how could I have done things differently? And how am I going to do things differently moving forward? What could I have done better? And just think that through, so that then you already have this experience under your belt, so you're prepared for it. And then you can prepare for possibly a better outcome. Be patient with yourself and with your learners, especially right now when we're trying to figure out technology, when we're trying to still figure out, you know, the best way to deliver our instruction. You know, we're all growing with this together. We're all working this out. We're trying to figure out, you know, what's going to work, what's not going to work. Just realize that it's just a process. We're going to get there. It's all going to be good. Find support, but make sure that it's positive support. While, you know, constructive criticism can be valuable, you don't want to go to somebody that is going to constantly criticize. You know, find those who will offer positive suggestions, just provide you some feedback. Take care of yourself. You know, that pretty much just says it all. And we'll talk about some things that you can do to do that. Take notice of the positives and mention them. There is something about actually saying something out loud that makes an imprint on our brain. So too many times, you know, we only talk about things that didn't go well. But if you have something that went well, like a lesson that went better than planned, or a learner who had a breakthrough, talk about them, share them with other people. because that will make an impression on your pathway. Also, be proud of the progress. Be proud of your own progress. Think back of, how would this lesson have gone a week ago, a month ago, a year ago, and be proud of how well your lessons are now compared to where they were. Also, be proud of your students and for even their small successes. Progress is progress, even if it's slow. Just mentally acknowledge it and think it through and realize that they're moving in the right direction. Okay, another one, coping with stress tips for educators. So we all have bad days and we all make mistakes. You aren't going to get it right every time, and that's okay. Just cut yourself some slack. We're all imperfect human beings. It's all good. So sometimes it's hard to see the impact that you're having on your learners. Change may not be happening in front of you, but it's happening. So know that you are making a positive impact on the lives of your learners. Also, we all have moments where we don't act the best that we could have. We let life's challenges get the best of us. Again, that's okay. Just if something goes wrong, own up to it, acknowledge it, make adjustments, and move forward. I can't stress this one enough. This is just my little thing. Exercise. I can't tell you how many times I heard at this conference about the value of exercise and how many articles I came across as I was preparing this presentation that talked about the value of exercise. I put on here the link to Fitness Blender. This is one that I use routinely. I love it. It's got lots of filters in it so that you can find a workout that would work out for you. But you don't even have to do that. Even just like a 10-minute walk around the block. I think we all have 10 minutes in our day that we can carve out just for that. It has been shown that exercise is as good as many antidepressants, and by many in the field of psychology, it is considered the most under-prescribed strategy for managing stress and depression. So can't stress that one enough. And of course, eating well-balanced meals. I think, most of us know the connection between, how we feed ourselves and how, it affects our mental outlook and how it affects us physically, mentally, emotionally. Okay, so here are some more. Of course, get enough rest. Much easier said than done for most of us, but felt the need to put it in there anyway. Cultivate a hopeful attitude by saying encouraging things to yourself. I know this seems maybe odd, but there's a strategy in which some will take little Post-it notes and they'll put words of affirmation on like their mirror in their bathroom, and they will actually say them out loud. Again, there are suggestions that even if you don't believe it, just saying it over time, it will create an imprint in your brain and it will change the way your brain is wired. So they'll have things like, you are valuable, you are enough, you are loved, you are productive. Just things that create positive thoughts in yourself. Fostering a sense of humor, just being able to laugh. And seek out and maintain at least one close personal friend. Somebody who you can confide in, someone who you trust, someone who will be encouraging. I did put it on here, but I probably should have. But also, sometimes you have to seek professional help. We all have struggles. We all have times when life just really, really gets to be too much, and it really requires somebody with much more knowledge and skills and strategies that can help us get in the right direction. Okay, so here are a few more. So practicing mindfulness, I put on here some apps. I personally use Insight Timer. I actually use it every day. I love it. I think it's great, but here are some more, three others that many find very, very helpful. Share experiences with instructors. Again, just talking about a similar experience, some might say, you know what, I had a similar experience and this is what I did. This is what worked for me. Focus on what you can do something about. You know, we get really caught up on things that we can't do anything about. But focus on those things that you can control. Set realistic goals. You know, we certainly don't want our learners to set unrealistic goals. So make sure that your goals for yourself are realistic. And I left on here exercise regularly just because that's how important I think it is. So we're getting near the end. I know we don't have any administrators on here, but I'm going to include this anyway. In case there are ones that listen to this as a replay. So here are just a few suggestions for administrators, so how they can reduce instructors' stress and, you know, stress in their program. So sometimes finding teaching staff can be very challenging, but administration might want to consider that to the best of ability to find instructors that are willing and able to build strong relationships with their learners. I can't stress the importance of the second bullet. Allow time for instructors to develop relationships with learners. And here are some ways of doing that. Having appropriate class size. That, you know, it's going to be very difficult to develop relationships with your learners if you have 20 learners in them. You want to have sufficient duration, frequency, and consistency, and reduce paperwork requirements. Yes, there's always going to be paperwork that's required, but if there is paperwork that's really not of significant benefit, I would just really encourage holding back on giving instructors more paperwork than what they need. And the last one is having clear expectations. It's very stressful for everybody when administration has one set of expectations and the instructors have a totally different expectation. So I say that maybe mostly to the instructional specialists. You know, just make sure that your instructors know what you expect from them, and you know what they should be able to expect from you, so that everybody's on the same page, and you know we're feel like we're all in this together. So here are my final thoughts. They are to be kind to others and yourself. To others means your learners, other instructors who might be struggling, and to even your supervisors. I can't express enough the benefit of being kind to yourself, especially now. We are all called to do tasks that may be outside our comfort zone. It's okay if you and your learners struggle. You'll get through it. You will work it out. Just give yourself a break. Also, have compassion towards others and yourself. And last, have empathy, especially for those who may have more challenges and struggles than either yourself or others. I'm going to put in a shameless plug here. I'm doing another one of these sessions on Wednesday about self-efficacy. And so I go into depth about empathy and the role that that plays in your classroom. So, you know, we're all trying to improve the lives of our learners and make the world a better place. So I'll leave you with this quote that I have here. Use your voice for kindness, your ears for compassion, your hands for charity, your mind for truth, and your heart for love. So I want to thank you all. So does anybody have any questions or any comments that they would like to share? I know I am almost out of time. I really went long here.
Thank you so much, Ramona. What fantastic information. Love the valuable tips and the strategies. And I can't think of a topic that is more timely than stress and anxiety right now. So thank you so much.
Sure, you're welcome.
I did put the feedback link in the chat room. If you would please give us some feedback. This is our second virtual training institute, and we are looking for ways to make it better for you and for everyone in your programs. So please go ahead and make sure that you take just a few minutes to fill that out for us. Thank you again to Ramona for sharing such valuable information. And thank you all for listening for the last hour about how you can improve stress and anxiety both in your life and for the lives of our learners. Thank you so much. Have a wonderful rest of the day, and we will see you in the upcoming VTI sessions.
Thank you.